infectious diseases at Mater Hospital. Paul, good morning.
Hello, Rebecca. Thanks very much for the chance to come in and chat today.
I'm going to just set the scene and say there is no question too silly or too simple this morning, because there's been so much discussion about coronavirus and what's happening in terms of evacuating people from Wuhan to Christmas Island, who should be wearing masks, some of the sentiment veering into territory that's really unhelpful. So this morning, let's just open the gates and say, if you've got a question on coronavirus, ask it and Paul will answer it. 1300 222 612. You can call now or send a text 0467 922 612. Paul, what is coronavirus?
So coronaviruses themselves aren't new. We've known about them for a long time, and they're typically viruses that infect animals and occasionally humans as well. And most of the time they're on the milder end of the spectrum. We've had a few notable examples over the last few years. Back in about 2002, we saw SARS come out, and that was a more severe coronavirus that caused about 8,000 deaths. And then we had MERS, which was the Middle Eastern Respiratory Syndrome, which another coronavirus that came out in about 2012. But that's really only caused about 2,500 cases, so much smaller issues than these ones. So this is a new coronavirus in that same sort of family, but certainly behaving in an atypical way compared to what we've seen recently.
So should it have a different name? If SARS and MERS were coronaviruses, should this one have a different name?
I think we're so early in that journey that we haven't arrived on the final name. So for a while we're referring to it as the Wuhan coronavirus, and then now it's the 2019/nCoV for a novel coronavirus, and it may well be that a different name is arrived upon in the fullness of time, but for the time being, that's what we're referring to it as.
Let's go to worst case scenario. Paddy sent a message saying, coronavirus, is it a death sentence or do people recover?
The short answer is it's not a death sentence. So the difficulty that we're facing at an early stage of an outbreak like this is that we're still learning a lot about it. We're still very early in this journey with a lot of information yet to be determined. But best estimates currently would say that the mortality rate is probably 2% or maybe even a lot lower than that. So I guess one of the main messages is it's something we need to take seriously and do our best to contain, but we certainly don't want people to panic because most people will recover from this.
The problem with authorities saying, don't panic, the more that you have doctors, premiers, prime ministers, and various other people in places of authority saying, don't panic, I wonder if it actually ramps up people's anxiety. Is this coronavirus worse than SARS or MERS?
It's hard to know what we base worse on. So in terms of numbers, we're going to have a lot more than either or both of those coronaviruses put together. In terms of how severe the illness is...
Hang on, a lot more people infected?
Infected, yes, not that pass away. So we know it's much milder than both of those. So the scale of this outbreak, pandemic, whatever you want to refer to it as, will be large, but it's much less severe than those two other coronaviruses that I mentioned earlier.
Why is the scale much larger?
Just because of how easily it's spreading so far. So we go through stages where we see different sentinel events in these sort of outbreaks. And, 2 weeks ago, had I been sitting here, I probably would have said this will be contained in China. There's only 40 cases. It's not too bad. And in the last 2 to 3 weeks, we've seen the number of cases go up exponentially. We've seen 27 countries now affected. So we've got 12 cases in Australia, for example. So this is clearly a virus that's able to be transmitted. But again, I want to stress it's far less severe in terms of mortality rate, particularly than those other coronaviruses. I think the best way to think about it is like a new flu. So in 2009, we saw a H1N1 or the swine flu pandemic, and that spread very quickly around. And initially we thought this was going to be really terrible, quite severe. But in the end, it was just a little bit more severe than perhaps the seasonal flu. So I think that sort of an example is similar to what might play out here. It's probably going to keep spreading, although we're all doing our best to control it. And that's why a lot of those measures are being enacted at borders and people are trying to get prepared to try and prevent that. But it's still likely that it will continue to spread for at least a little while.
So on par with the flu?
I think that's our best estimate at the moment. It's going to be like a new flu, which we last saw in 2009.
What are the symptoms of coronavirus?
Again, just as a good example, it's very similar to the flu. So we see at the moment the case definition and what we've seen in most is a febrile illness with some kind of respiratory symptoms, so shortness of breath, cough. But as we're getting more information, and I think the cases on the Gold Coast really highlighted this, we can also get gastrointestinal symptoms, so diarrhoea might also be a symptom as well.
How is it transferred, and is it always from person to person?
So again, very similar to the flu. So we think at this stage it's what we call droplet. So needs a fair bit of stuff to be coughed or sneezed upon somebody else. And it may also be transmissible via the fecal-oral route, given that we do think it's perhaps shed in the stool. But again, we're so early in this event that we're still learning a lot every day. And I think there's been a lot of criticism about inconsistencies or people not knowing things. But we truly are getting more and more information every day, which is why a lot of the advice is being updated so frequently.
Why is it deadly for some people?
So we have seen quite high rates of more severe illness, particularly early on and particularly in China. So again, very similar to bad flus. People are getting quite severe respiratory symptoms and ending up in intensive care units and that sort of thing. But again, just to reiterate, the mortality rate as best we can estimate at the moment is likely to be less than 2%. So a lot of those people will still recover.
Associate Professor Paul Griffin, the Director of Infectious Diseases at the Mater Hospital. I'll take your calls in a moment. You can send a question by text as well, 0467 222 612. Just having a look, I mean, there is so much information and misinformation out there, but I'm looking at an article from Business Insider that says experts think the Wuhan coronavirus jumped from bats to snakes to people. Is that right?
Again, we can't be sure just yet. There's a lot of really clever epidemiological studies happening in that wet market in Wuhan where the cases were first found. And it was interesting that there's a whole lot of different sections in that market. And when environmental samples were taken, the highest number of positives was in the seafood section, suggesting there may have been something to do with the seafood. For a little while, there was thought to be a strong association with snakes. Maybe that was the origin. But I guess at this stage, we just don't have enough information to be certain about that yet. We know coronaviruses often infect a range of animals, and something led to some kind of crossover event, and it did seem to centre around that market, but we just can't be sure just yet.
Okay, and that market, that's a specific location when you say wet market, as in seafood sold in water.
I've seen lots of pictures and heard lots of stories about this market over the last few days and weeks. And so, yeah, there's a very large live seafood section apparently, but then there's also another area containing basically every type of live animal imaginable, from bamboo rats to other things. So it's a very busy market with a lot of different types of products there. So I guess that makes it, you know, one of the reasons why it's been really hard to pin down at this stage.
Just going back to that Business Insider article, it says bats have been at the source of at least 4 pandemics. Is that right?
I mean, that's one of the things we have to focus on at the moment is that fear and misinformation is spreading a lot more quickly than this virus. And I think everyone saw the picture of the people eating bats, and that didn't even originate from China. So I don't think we can say for sure that this has originated from bats. Bats are a really important factor in a lot of viral illnesses, you know, including things like Hendra, for example. So we know bats are likely to have had some role, but to what extent we can't say for sure yet.
Tim's called in from Greenslopes with a question about being on board planes. Morning, Tim. Go ahead.
Oh, hello. A news report on the television said that on the aircraft that's going from Wuhan to Christmas Island, that the virus can be filtered from the recirculating air. I can't understand how that can be possible because viruses are so tiny, they're on almost a molecular level. How can that virus be filtered out of the recirculated air, or any virus for that matter, because they are so tiny?
Look, that's a really good question. And when we say this is likely to be droplet, there's a big distinction with pathogens that we describe as airborne that are much more likely to be able to be transmitted through recirculating air sources. And at this stage, we think this is largely droplet. So the particles are a bit bigger than those that can facilitate airborne spread. So to that end, we think that those sort of measures will probably be effective. The trouble, again, with being so early in this journey is we think that this is droplet, but to be honest, we're not completely sure, which is why a lot of the precautions you'll see healthcare facilities and others taking include airborne precautions. But my understanding is that there's going to be some physical separation as well of different families and cohorting and those sorts of measures on that plane to try and reduce that risk as much as possible.
Thank you, Tim. I mean, yeah, what about the risk to the pilot, to the airline staff, Ryan? Sorry, Paul.
So I think that there's been a lot of experts have an input into how this exactly will play out. And I'm sure they're taking the most precautions that they can. I think the risk, given that it's being done in such a controlled way with medical teams and other experts contributing, that I think the risk to those particular staff will be extremely low.
For those who are, amongst us, there are people who would self-identify as germaphobes and maybe particularly keen to wear face masks. What is the best way to protect yourself from germs, from viruses, from the coronavirus?
So this is the same messaging that we try to get out every year in the flu season, and really the measures are quite simple. I guess I'll start with masks, and really the use of masks in such a widespread way probably doesn't really help all that much. The masks that a lot of people are using probably don't really protect them. The one thing it does is provide a physical barrier from touching a surface that might be contaminated with the virus and then rubbing it on your mucous membrane, so touching something and rubbing your nose or mouth. And if you just adhere to good hand hygiene measures, then that risk can be averted in that manner in a much better way.
So washing your hands could be better protection than wearing a mask.
Absolutely. And that's the main message we try to get out every year with the flu season. So if people need to easily conceptualise what sort of measures to take, just think of the flu season. And we see a lot of people underestimate the flu and then overestimate these new sort of things. But if you adhere to these basic hygiene measures, you'll protect yourself very well. So the main message is hand hygiene, particularly before touching your nose or mouth. And that can be either soap or water or an alcohol-based hand rub. It's also cough etiquette. So coughing into your elbow or sneezing into a tissue and disposing of it, and then using your hand hygiene. And I guess just trying to stay away from people that might have respiratory viral infections. The probability right now is if you see someone in the street who's coughing, sneezing, looks a bit crook, is they probably have the flu or another respiratory virus. It's probably not this virus at this stage. So try not to spend a lot of time in really close proximity to people that are unwell. And I guess if you are unwell, at the moment, the main thing is to try and get seen if you've been either to the area that's currently listed, which is all of China. So if you've been to China and you return within 14 days and get symptoms, it would be good to self-declare that and get seen and get tested, or if you're a known contact of a positive case. But otherwise, I think it's also good to get checked out if you have a respiratory virus, just so we know exactly what's going on. Is
hand sanitizer as effective as washing your hands with soap?
So this is something that's always debated, and the simple answer, I think, for most people is just to think of it as yes. We have some pathogens, not these, for which we know alcohol-based hand rubs probably aren't quite as effective. But really, in the end, washing your hands is the main thing to remember. Doesn't really matter what with.
Okay, hang on. That's not entirely clear to me. So if you got two choices, Paul. You can either use hand sanitizer or wash your hands in a basin with soap and water. Which do you do?
Either. So the main thing is to remember to do it.
They're equally as effective?
For most things, yep.
Okay.
So certainly for these sort of viruses, we'd encourage people just to do the hand hygiene at the right time and not to get too caught up in what you use.
Okay. Associate Professor Paul Griffin in studio this morning, the Director of Infectious Diseases at the Mater Hospital. Is this on Facebook Live as well, on the ABC Brisbane Facebook page at the moment? Yes. If you want to see the Associate Professor, you can check in there. And if you've missed the first start of the chat, you'll be able to see it on the ABC Brisbane Facebook page. Jim's called in from Kenilworth. Jim, you're worried about the spread and containment of coronavirus. What have you seen?
Yes, good morning, Paul. I travelled from Indonesia last Saturday morning, and my observation is that I actually work in Indonesia. There's a large population of Chinese tourists there and are travelling there daily, and then also a large population of Australians that are holidaying there as well. At the Bali airport, the Denpasar airport, I wasn't screened at all, and I didn't notice any screening, and there was no screening at all when I arrived in Brisbane on Saturday morning. So it appears that there's unrestricted travel in Bali with a whole mix of people from all around the world, and then nothing on Australia's border. And it seems in contrast to all of these people that have been flown to Christmas Island to be quarantined down. I'm just wondering, my question is, how is this happening?
Yeah, look, that's a good question. And this is one of the things that's evolving very rapidly. So the response to travellers will probably change perhaps on a day-to-day basis. So at this stage, there are active screening measures for people that have returned from China. Now, we know that people may travel via other areas, but at this stage, there's not been sustained person-to-person transmission really outside of China. There's been a few cases of people getting it from people that had been to China in certain countries, but that's not really at the stage we're at now. So we're not seeing a lot of those secondary transmission events that mean we need to, screen all travellers. And again, this may evolve. So if there's another country that we see sustained person-to-person transmission, it's likely that the response in Australia will include screening people returning from those areas, but we're just not quite there yet. I think that the main message is if there's a general awareness in the population, not to panic and not to overreact, but just to be aware that if someone has potentially come in contact with a case or has been to China, that they get tested. And I guess just to heed the advice of the authorities that are updating those messages every day.
Jim, thanks for your question. Paul, why did it originate in China?
A good question. I mean, these viruses just do this. So a lot of these viruses have spontaneous mutations or a combination of events, which means they can get new properties. So this may have been, and again, all of this will come out in the fullness of time, but this might have been based on a virus that's been circulating in a particular animal, probably not causing too much disease for a period of time, ranging from months, years, or even longer. That then something happened, as I said, whether it skipped across to another animal or had some kind of other event, it then gave it the ability to do this, so to be transmitted fairly readily in humans.
John at Laidley Heights says, are there other viruses of concern coming out of China at the moment, or is it just coronavirus?
I guess one of the things that's improved a lot based on SARS, which also accounts for how this was picked up so early, is there's a lot of screening. So there's a lot of screening if people present with a pneumonia or a respiratory illness of unknown cause. They go to great lengths to try and identify it, and that's essentially what happened here. But a lot of screening of certain animals, particularly birds as well. And people might have seen some recent reports of a bird flu not far away, but really that's status quo. That happens all the time. If we actively surveil certain animals, we'll find these sort of viruses, but there's no evidence that one's causing problems in people yet.
Just on SARS, Gavin at Paddington says, did the 2003 SARS virus mutate to become more virulent and more communicable?
Good question, and something that's still debated, to be honest. It is thought that it did, that there was a period of time where it became a little easier to pass on. But then even some discussions amongst my colleagues have pointed out there were probably some environmental factors that contributed to some of the outbreaks of SARS. So it probably did. People are asking that same question already about the novel coronavirus. And as best we can tell, I heard a talk from an expert yesterday, there's no evidence that there's been any kind of mutation since we first started seeing cases. A lot of people were suspicious of that when we saw a huge upspike in cases about a week or two into this event. And a lot of that was accounted for by the rapid scaling up of testing and rolling out of that testing and then identifying a lot more cases.
What makes a virus mutate?
All sorts of things. It's one of those things that viruses just do, and then if it gives them some kind of benefit, then you see that virus take off. And that might be what happened here, is this virus may have acquired the ability to be more transmissible, and so this is what we see.
Mary's called in from Alderley with a question about a lab. Mary, good morning. Go ahead.
Oh, thanks, Rebecca. I read that there is a research facility in Wuhan, I've got probably the pronunciation incorrectly, that does deal with research in this area, and that viruses, or one, have escaped from sort of into the community from there previously. That there is this laboratory right there in that centre where it's happening.
Yeah, so I think there are lots of theories that maybe this was something that did escape from a research facility, but I don't think there's any evidence for that. I think the environmental sampling of the wet market would certainly lead us to believe that that's where it originated. I think these days, if people are researching agents like that, there are so many mandatory measures of containment that I think that the possibility of something like that is very remote at best. And so I really don't think that that's going to be what's happened here.
Thanks, Mary. On that, though, let's go a step further, Paul, because someone on text says there is a biolab in Wuhan. Surely it's not crazy to think they might somehow accidentally or purposely release this virus into the public. China and other countries are looking into bioweapons.
Yeah, as I said, there's a lot of laboratories worldwide doing a lot of good research into these viruses, but I think there's just simply no evidence at this stage to think that this was something that was deliberately or accidentally released from some kind of facility. This is what these viruses just do, and as I said, SARS and MERS are really good examples of where this happens in the environment. Timing-wise, it's almost exactly 10 years apart, all those three events. So on the balance of probability, it seems very likely, and I think the evidence is strongly supporting that this is something that originated in or was first detected from that fish market for a whole lot of reasons.
Associate Professor Paul Griffin from the Mater Hospital. 25 minutes to 11, you're listening to ABC Radio Brisbane. In the wake of the coronavirus outbreak, Paul has kindly agreed to answer any and all of your questions this morning, some coming in on Facebook as well as text. Harry says, is it true that the virus can be passed via faeces?
So there is evidence that it is shed in faeces. Again, we just don't have enough epidemiological data to confirm that fecal-oral transmission has occurred, but we think it is likely. So again, all of our healthcare facilities are taking appropriate steps if we were to see a case to include precautions against that as well.
Harry says, should we avoid public toilets?
The simple answer, like a lot of fecal-oral pathogens, if you adhere to your appropriate hand hygiene, you'll protect yourself. So I don't think we need to change our habits there, other than just to reiterate the simple things that we teach our kids from a very young age to wash your hands afterwards.
And part 3 of Harry's question, can it be passed in high-rise buildings via dodgy plumbing? He says, like SARS was. Is that the case with SARS?
So there were a whole lot of really interesting epidemiological things that we saw with SARS. By all accounts, the sewage was passing through somewhere covered by an open grate, so potentially allowing those particles to be easily passed to other people. I think our plumbing infrastructure in itself is a lot better than that, so I think that sort of thing is highly unlikely to be the case in Australia.
Charlotte says, this might sound insensitive, but it's not meant that way. Is this virus affecting one ethnicity more than others?
I think the answer there is no. I think that's where we think the virus originated from. So obviously we're seeing a lot more cases in that area. And I think there's no evidence to suggest that certain ethnicities are more or less vulnerable. We do know with this virus that it seems that the elderly are slightly more at risk. So the median age of people affected so far is in the high 50s. And certainly the people that have had more severe illness have had some kind of comorbidity or background medical problem that probably contributed to the severity of the illness as well.
Yeah, which leads to Leah's question from Ipswich. Good morning, Leah. Go ahead.
Hi, Rebecca. Yeah, I heard a bit earlier that a gentleman asked, was it fatal? And the answer was no. But my question is, how are people dying then?
So I guess just to clarify, we know from the numbers so far that the mortality rate, so the number of people that die is around 2%. So certainly there have been deaths. So there's been around 425 deaths as of this morning, but that's in over 20,000 confirmed cases. And those numbers are very hard for us to be confident in right now because there's probably a whole lot of other people that are affected that haven't yet been diagnosed. So while we're quoting a mortality figure of just over or just under 2%, it may well be a lot less than that. So yes, certainly some people have died. But if you were in Australia and you were to contract this virus or you were to return from China with this virus, you're at 98% or higher chance of recovering.
Does that make sense to you, Leah?
Not really.
So certainly we do see severe infections, and around 2% of the time, so for every 100 people infected, unfortunately 2 are likely to succumb, but it's likely or die, but it's likely that the number of people that die will actually be less than that as we get a full handle on how many people are infected.
So it can be fatal?
It can be, yep. So
right.
Around 2% of the time.
Okay.
Thank you, Leah. But it's likely to have those people will have a comorbidity, another ailment or element in their health that makes them already unwell, or if they're elderly or young.
Yep, absolutely right. So the same people that can be susceptible to other illnesses, even like the flu, are the ones that are likely to have more severe disease here.
Yeah. What's the mortality rate with the flu?
So percentage-wise, it's less than that. But then we see, somewhere between probably 1 and 5,000 deaths per year in Australia from the flu. So I think this really highlights an interesting paradigm that people kind of are complacent with the flu, but then at this stage, and particularly in our country, it's a much worse illness numbers-wise and deaths-wise than we've seen so far from the coronavirus. So that's something else that I'd like to let people know is it's still really important to take the right steps with the flu this year, and I'd strongly encourage getting a flu vaccine because there's going to be a lot of suspicion that if people do get sick that they might have this new thing, whereas it's most likely to be the flu. So if we can control the flu a bit better this year, that's going to allay a lot of people's concerns.
Rick from The Gap says, I'm travelling to Melbourne soon. Should I wear a mask on the plane?
So good question, and I travelled back from Melbourne last night and saw a lot of people with masks. So the situation in this country right now is we have 12 cases who are all confined. We have active measures in place for people that have returned and might be harbouring this virus, and no evidence of person-to-person transmission yet in Australia. So I think a mask is probably over the top right now for domestic travel. And as I said earlier, it may not actually protect you all that well anyway. Again, I'd reiterate hand hygiene and trying to stay away from people that look really sick would be the best way.
Karen says, how do you protect yourself in public restrooms and school restrooms? I'm concerned about body fluids.
So again, it just comes back to hand washing. It really does. So it's still the single best way of preventing any infectious disease, and that certainly applies for this one as well.
Elam says, why are people only dying in Wuhan, not the other cities in China?
So we have seen fatalities start to increase outside of that area. Again, it's just a numbers thing. So that's where most of the cases are. And if a proportion of people, unfortunately, are going to get sicker and pass away, then that's where we're going to see the concentration of those events as well. But there was a man who passed away in the Philippines just yesterday. So it's not just going to be Wuhan, unfortunately.
On text, someone says, how long will people be quarantined on Christmas Island if one person comes down with the virus every 2 weeks?
That's a good question and hard to have a sort of generic response to that. Again, I'm confident that there's enough experts that are involved in that process that'll be handled well. Obviously, there's a lot of interest that need to be balanced there in terms of that situation. If there was people that were confirmed there, they would be isolated, then there might be a period of further isolation required for contacts of that person. But again, I trust that the people that have decided upon that and are managing that situation are doing it well.
You know how you talked about good coughing and sneezing hygiene into your elbow. How long does a virus live on your elbow?
Good question. So, I mean, every virus is different and we don't know yet for this coronavirus. We think it's probably not too long, but certainly if you have good cough etiquette and cough into your elbow or your hands and then use good hand hygiene afterwards, we know that's going to greatly reduce the chance of passing this on to somebody else.
Philippe has sent a text as well regarding what people eat. Specifically, he's saying it's his belief that Chinese people eat a range of different animals. Does that affect your likelihood of getting coronavirus?
So certainly there were a number of animals that did test positive at that wet market, and I know some advice from the WHO includes not eating undercooked food, and I think that's probably largely generic advice with all of these things, and I think food outside of that area is probably safe. But again, I'd recommend people just adhere to sort of usual measures of appropriate food handling.
Yeah, well, that goes to Lynette's question, who references the World Health Organization and the advice not to eat uncooked meats. What is the connection between the virus and uncooked meat?
So it was found in multiple samples in that wet market, mostly in the seafood section, but some samples from outside of that. So it's quite likely that a lot of food products around that area were contaminated, and so that's possibly a source of transmission in that area. I'd be really doubtful that that's happened outside of the really concentrated centre of that in Wuhan.
It's 11:15. You're listening to Associate Professor Paul Griffin, the Director of Infectious Diseases at the Mater Hospital. You've been so generous with your time this morning. Let's just see if we can whip through a couple more questions, because clearly there is such a thirst for information and accurate information, which is what you're giving this morning. Lots of people are acknowledging that and grateful for that, Paul. Andrew at Highgate Hill says there was talk early of asymptomatic transfer of the virus. Any updates on that?
So it's looking increasingly likely that is a possibility, and that is one cause of slight concern. Again, not panic, but something we need to monitor. So it does seem likely that people, just before they get symptoms, can pass this on, which will make our measures to contain it a little more challenging. So it is something that we're monitoring fairly closely.
Right. So can you just talk us through the timeline of coronavirus, if you like?
Yeah, so the incubation period we think is probably around 5 days, with a range of 2 to 7 being proposed, and maybe even out to 14. So that's why you'll hear in a lot of sources at the moment we're quarantining people or isolating people for up to 14 days. So it's likely it'll arrive at a slightly lower number than that, but again, we need more information to be sure. And it does appear that for a short period of time, most likely, before people exhibit the obvious symptoms, that they may be able to be infective to other people via those same measures. So through some of those body fluids.
Right. So the incubation period could be 5 days, and in that time you may not have any symptoms and you could be contagious.
Yep.
Then how long will you have symptoms for?
Again, we're still sort of getting that information. I think a lot of the cases have been unwell for around a week, but again, it's too soon to know exactly what the time course is like of the actual illness, because we're still getting that information through now. I know that the Gold Coast cases, for example, I think they're still unwell with some symptoms out to around a week. So it's likely, again, I think this very much parallels what we see with the flu. A lot of people, when they get a cold, that might only last a day or two and a bit of a sniffle. But when you get an actual infection with influenza, people are often unwell for a week or two. And I think this one will be very similar to that.
Yeah, or more. I had influenza
Absolutely.
A last year. It took me, I reckon, 3 weeks
Absolutely.
to get back. I mean, really sick for a week, but then maybe 3 weeks to feel sort of back to normal. What is the treatment for coronavirus?
So at this stage, we have no treatment. And I guess that's one thing that is a bit different to the flu, is with the flu, we've at least got a vaccine and we've got some antiviral therapy. At this stage, we have neither for this coronavirus. But I guess we're in a fortunate position that's very different to even MERS, but more so with SARS, that our ability to discover more things about these new pathogens and to do something about them is better than ever before. And, I know the UQ group are advancing some measures to try and produce a vaccine fairly quickly. There's a lot of work happening, a number of groups trying to work on vaccines. A lot of people are working on faster diagnostics. So our capabilities generally to address these sort of pathogens is greatly improved. So I think that will certainly help us a lot.
So no treatment. If you get coronavirus, it's likely you'll be unwell for a week and then you just get better.
That's what's happening in the majority of the cases.
Yes.
Yep.
Okay. Corey says, we are travelling to Bali in March. Should we be concerned about travel? How can we ensure we are safe, especially our young daughter?
So a really good question, and my advice here is that things are changing so rapidly that for any significant overseas travel, I'd recommend seeing your GP for the appropriate travel advice, and then heeding the warnings of reputable sources like Smart Traveller, as well as the federal and state government advice on what to do. So, at the moment there's no person-to-person transmission really documented, particularly in a sustained way outside of China. But again, this is something that's evolving very rapidly, so generic advice at this point in time is hard to give. But just, my advice overall is to try and avoid misinformation and questionable sources and pay good attention to the reputable sources of information at times like this.
Casey says, is there anything in particular we should be watching out for in a young child that perhaps wouldn't be able to explain their symptoms?
Yeah, so I think if a young child has the right epidemiological link, so has returned from China, I think any symptoms should prompt appropriate testing, but that'd be guided by the clinician seeing that person at the time and the public health authorities involved as well. So, I think it's about just assessing on its merits at the time.
What's the test for coronavirus?
So this time it was really good that the people at the area involved quite early on released the genetic sequence, the DNA sequence of this, so a lot of places could develop a molecular test, and Queensland was also one of those places. So these days, once we know the sequence of the virus, we can develop some little things that attach to that called primers and amplify that in a way that can tell us if it's present or not.
Okay, but is that a swab up your nose?
So at this stage, it's a nose swab and or a throat swab, so on a respiratory specimen.
Karen says, should people in other countries who've reported cases start wearing masks?
Again, the whole mask thing, it's been what we've seen all through social media, and everyone's wanting to buy masks, and it's caused enormous problems in terms of supply because the mask suppliers are running out. And interestingly, one of the biggest mask manufacturers was in Wuhan, so we're having a significant issue with supply. But at this stage, there's not really the evidence for widespread use in the population.
Someone on text says, get people to up their vitamin C above the dose that's recommended. Would you recommend that, Paul?
So it would be great if we had supplements and other things that we could use to boost our immune system. And while I can't say for sure that it doesn't help, there's no evidence in a sort of medical basis to support the use of those sort of interventions. I think anything that makes you feel better is a good idea. And, probably being healthy with a good healthy diet and all those sort of things probably contribute as well. But unfortunately, there's no supplement that's been proven to boost the immune system. But it's probably not a bad idea if it makes you feel better.
Andrew says, I was told that from one of the incident cases early on, 14 healthcare workers were infected. Could that have happened?
Again, we're still collating information, and it's hard to know how reputable some of these reports are. I think that there's a lot of suspicion that there has been a lot of healthcare transmission in Wuhan. How much of that was before we knew what we were dealing with and knew to take the right precautions is unclear. Certainly, as far as I'm aware, outside of Wuhan, there's been no healthcare cases as yet. Obviously something that is quite transmissible, that may well be the case. But healthcare workers, as for people in the community, if you adhere to some of those basic measures, and in healthcare, if we're dealing with cases, we wear personal protective equipment as well. But really hand hygiene and all those measures are just as important there too.
Wash your hands.
Absolutely.
That's the big message on text. Is the airborne transmission of the coronavirus reduced in areas of higher humidity?
Again, hard to say for sure. I mean, we know that the environmental conditions certainly affect a lot of properties of these viruses, how far they can transmit, how long they survive, and that can be temperature, humidity, and other factors. I don't think we can comment with any authority on the ideal conditions for transmission of this because it's just too soon.
Yep. Judy says, do local medical centres have protocols in place? If so, what? I guess she's saying if people use online booking systems, how are they going to know if they're potential carriers turning up at the medical centres without questioning?
So there's been a lot of information disseminated from a lot of the medical colleges, so the GP College, Emergency, a lot of others, and there are plans in place that are being led by public health services, both locally and on a broader scale. The main thing is if people have the right epidemiology, so have returned from China, that they flag that early. And they can do that either via calling 13Health or calling ahead to their GP. It's just about notifying that that's what you're suspicious of so the right measures can be taken and that the right preparations can be in place.
3 final questions, then I promise, Paul, we'll let you go and get back to your day. Rose says, what about echinacea? Isn't it a proven antivirus?
Same as the vitamin C. So, I think that there's a lot of anecdotal reports and a lot of perception that these sort of things can help. Unfortunately, particularly with the battling of viruses, there's just no robust medical evidence to prove that it does work.
Gemma says, what about tissues? If we blow our noses and put them in the bin, is there a danger of making people sick?
So certainly if they weren't disposed of and people didn't adhere to the right hand hygiene after doing that, there's a possibility. But, that cough etiquette and disposal of those sort of things is the same as the flu. So if you're using tissues, try and dispose of them in the bin and use your proper hand hygiene afterwards.
Kelvin at Kenmore says, how did the SARS virus end? Was it down to a vaccination or natural lifespan once it stopped spreading?
So SARS was a very different virus in that it was likely to be more severe than this one and less transmissible, although again that's information we're still putting together. So I think it was just the really robust infection control measures that we implemented that helped to curb that one.
Yes. I lied. There's 2 more good questions. Is Ebola a coronavirus?
I would encourage people to have no connection between this event and Ebola because I think a lot of people are thinking they're very similar. Ebola is a completely different illness. It's far more severe, transmits in a completely different way, and people have these perceptions of these really sick people in their minds. And so I'd encourage people not to link this in any way to Ebola. It's in no way comparable. How
will the coronavirus end or get under control?
Good question. And, at this stage, no one has a simple answer for that. It's clear we're all in a state of trying our best to contain this, and that's why there's a lot of measures being taken at hospitals and at the borders and via all levels of government and public health. And I strongly believe that that's a good thing to do. If we can delay or contain this, then that's obviously a great outcome. How it'll end, we just don't know. So, it's impossible to know whether our measures will be effective. And even if they're not, all this containment activity is still beneficial and potentially delaying it if it does happen. But again, I just want to stress that, taking all these measures to try and slow it down or contain shouldn't alarm people. It's what we do all the time and it's just trying really our best to keep a lid on it.
Are you worried?
I'm not worried. This is something that, we do our job for and we see all the time. And, in my career in infectious diseases, we've seen SARS, MERS, the swine flu epidemic in 2009, and it's just something that happens. These viruses do change. They do acquire these capabilities, and we just need to do our best to control it without panicking, I think.
Really appreciate your time this morning. Thank you. Associate Professor